In this lecture, we'll be taking a closer look at the human hand. This is part of the lecture series covering the appendicular skeletal structure. We will start our brief overview of the hand and some of the important muscles associated with gross movement. We'll start with the carpals. So the carpus or wrist, it consists of, in this case, 8 small bones or carpals. Each of these are united to one another by ligaments. The bones, in a sense, are ranged in 2 transverse rows with 4 bones existing in each row. Now, as you're starting to kind of learn these different bones, realize that they are named for their shapes. In anatomical position, and I have another slide coming up in just a moment that you can kind of pause the lecture series with and zoom in and look at that more closely. There are also lecture materials that accompany this video lecture, so make sure to look at that as well. So in anatomical position, the proximal row, that row which is closest to the distal ends of the radius and ulna, so this is again closer to the shoulder when we're thinking about the 2 rows that we'll be looking at. So in the proximal row of the carpals, going from the lateral edge to the medial position, we have a scaphoid bone. This kind of looks like a boat, hence the name scaphoid. We have a lunate bone. This resembles a kind of crescent moon shape, especially if you're looking at it in its anterior-posterior aspect. A triquetrium, which has 3 articular surfaces. That's why it is named as such, but then that's what makes it unique. And then a P-shaped or pisiform bone. And in about 70% of cases involving injuries to the wrists, only the scaphoid is involved. So in this case, you have a scaphoid, lunate, a triquetrium, and a pisiform. And in terms of injury, generally or always look to the scaphoid first for understanding that. The distal row of carpals, then from lateral to medial, consists of a trapezium, a 4-sided bone. Again, these are all irregular bones. A trapezoid bone, also 4-sided in nature. A capitate, it's rounded on kind of a projected end. Then the head is kind of what we recognize to be that projection. And then it articulates with the lunate bone, the second bone I mentioned, associated with that proximal row. So the capitate, and think of, again, think of head and that shape, and decapitate, that's the way I remember it. And then hamate, named for a large hook-shaped projection on its anterior surface. And the hamate bone is the one that is probably easiest to identify, and it can be, with just the right movement, it can be palpitated so that you can feel where that is located. But again, named for its large hook-shaped projection on that anterior surface. Now, what's interesting about the bones of the hand relates to growth and development. And so let me just take you through what William Bass provides us with regard to some of the important growth and development issues in the hand. And then the other piece of the puzzle that we'll be looking at with regard to the bones of the hand relates to handedness. Remember that as human primates, we have a unique ability to be ambidextrous, and we have used our ability to manipulate make fine manipulations associated with our hands to be able to do some amazing things. Early on in human history, of course, tool production is going to be a very important part of this process. Prior to this, many anthropologists recognize our successful arboreal lifestyle to be definitely part of this kind of unique movement type. And then also the kinds of foods that were important throughout the fossil record and the living record with regard to animal forms that had this kind of unique quality to their upper extremities. So let's look at this growth and development piece for a moment. So at 10 years, as William Bass points out, in males, the epiphyses, these growth plates, for the radius, the ulna, the metacarpals, which we'll talk about in just a moment, and the phalanges, which we'll be talking about as well. By 10 years in males, they are ossified, so they are set in terms of their overall length. The epiphyses of the phalanges have unique shapes to them. When you look at them in cross section, at their shafts, for example, the distal phalanges of the second to fifth fingers are wider than their shafts, so they have this very unique kind of shape. You go to the shaft or the diaphysis of this long bone in miniature, and it's narrow and round. And as you move to either end, you will see it increase in size. Now in females, ossification, again, at 10 years of age, all epiphyses are a little bit more advanced, so they have already started to completely obliterate, or not completely obliterate, but they will begin that obliteration process by the 10th year. The styloid process of the ulnar epiphysis is beginning to form by 10 years in the female. The epiphyses of the distal phalanges, especially the third finger, have begun to cap their shafts, and then in a following few years, as William Bass points out, most epiphyses of the phalanges in a sense, prior to their union with the shaft, will resemble these little kinds of caps. So there are unique kinds of shapes which develop and are associated with the growth and development of the bones of the hand. By 15 years in males, the epiphysis of the radius has capped its shaft, and that, in this case, the ulna is as wide as its shaft in terms of that end. All carpals have now attained their early adult shape by that 15th year, and then fusion is underway in all of the epiphyses of the distal phalanges, and we'll talk about those in a few moments. So again, growth and development are unique, and that 10th year for males and females and that 15th year for males and females represent important windows of time for the adult form of these particular kinds of bones, including the bones of the lower portion of the upper extremity. All of these, in a sense, are taking shape and have all of the different kinds of landmarks that are important for their identification. Fusion is completed, as Bass points out, first in the distal portion of the phalanges, next in the proximal, and then last in the medial or middle phalanges. And this is associated with the second, third, fourth, and fifth fingers. And I'm giving you these details not that you're going to be necessarily directly tested on these minute details, but I just want to give you a sense of when we see those adult characteristics being present, because that's important for their identification in terms of direct skeletal evidence, but also in terms of, in this case, radiographs and other resources that we use in the healthcare professions. Now take a few moments. You can even pause the video at this point, zoom into this particular resource, this image, and take a look at how the particular digits of the hand are numbered in terms of that kind of medial to lateral or lateral to medial kind of perspective. And then where these various rows of carpals are located. So where is the carpus? Where are the various rows? How do we distinguish those? What are the bones of each row? And then cross-reference this information with the illustrations and identifying descriptions in William Bass's text. For your exam, you may not have to identify these individually. However, it is important to know what's unique about each of the different bones in this portion of um, the human skeletal anatomy, and then consider when we start to see adult expressions of these various bones in their size and shape and length, what age that occurs at, and maybe why that might be the case in terms of how we were designed or kind of the created plan for our growth and development as it relates to our skeletal anatomy. Now let's turn to the metacarpus. Now the metacarpus is going to be a general term that is going to be assigned to the 5 bones that we associate with this portion of the hand. This would be again associated with the location of the palm. Again, think about, the size, the shape, the orientation of these bones, and the role that the palm will play when we start looking at hand movements. And I'll talk about some gross hand movements, and then we'll take a look at just a couple of the muscles associated with this portion of the upper extremity. So meta meaning after, these bones constitute the palm of the hand. Each metacarpal bone consists of 3 parts: a base, a shaft, and a distal head. So the head, or where we recognize the head to be, this is most distant from the midline of the body. It is most distant from, depending on the orientation again, if it's in correct anatomical position, it's most distant from the base of the skull. The metacarpal bones are numbered from 1 to 5, starting with the lateral bone. The bases are going to articulate with the distal row of the carpal bones. The heads will articulate with the proximal phalanges of the fingers. Remember, proximal, middle or mesial, distal, right? So proximal. So the proximal row is what they will articulate with regard to the phalanges or the fingers. The heads of the metacarpals are commonly called the knuckles and are readily visible and something that you can feel when you make a fist or when you clench a fist. Now here too, Bass gives us some really important details to consider. Not as much with growth and development this time, but with the idea of handedness. Because remember that the skeletal system, your skeletal anatomy, is going to give a bioarchaeologist, a biological anthropologist, details regarding the habitual movements that are part of your everyday lifestyle or life way. So handedness is something that we can start to see expressed on particular portions of the bone, again, more so associated with articular surfaces, and that makes sense in the sense that, hand movements are what we're really focusing in on when we're trying to determine handedness. This is also something that can be applied in forensics. So the shafts of these bones, what's really interesting about them and something that I personally am able to use to identify them right away is their curvature. The shafts of these long bones in miniature are very much curved, as to be slightly concave on the volar or palmate surface of the hand. So there is a slight concave nature to the dorsal side or the back as well. So you have convex nature. So concave on the palm side and convex on the dorsal side. This is a trait that bioarchaeologists and paleoanthropologists have looked at in terms of the biomechanics and the ability to grip and the effectiveness of our grip. Having a slight curvature to these metacarpals is important because it gives that hand that unique shape and ability, that curvature, to be able to grasp onto things more readily and exert more force in terms of clamping down on things. This trait becomes more hyper-expressed as we move across the great apes and, of course, into other non-human primate areas of the living primates, including not only the monkeys, New World and Old World, but then also prosimians and other forms there as well. The idea here is that that curvature and their elongated nature in the larger bodied primates was and is very helpful in terms of navigating through that arboreal or tree dwelling environment. A particular kind of locomotor pattern like brachiation is very much connected to the overall architecture of these bones. We see the same with the metatarsals of the foot, but a slightly different design there. But needless to say, that ability to grasp. And again, brachiation is that hand over hand kind of movement. You have retained, in terms of what modern science is supporting at this time, uh, but you have retained these qualities. And so this is another part of your skeletal anatomy, which, according to anthropology, reflects that same kind of developmental history and ties you ultimately to the idea of an arboreal lifestyle. So the head or the distal extremity, as Bass points out, articulates with the proximal or first row of the phalanges. The heads are all present, they're large, they're rounded, and they're fully articulated. So they have that unique kind of expression, in this case, of articular cartilage associated with each of them. The first metacarpal, or the thumb, is the shortest and thickest of the metacarpal bones that we look at. It has a saddle-shaped carpal articular surface, and that's one of its distinguishing characteristics, so make sure to look at that in terms of illustration. Again, nothing you would have to directly identify. However, it is something that is important to keep in mind. The second is the longest metacarpal. The third, fourth, and fifth metacarpals successively then decrease in length, and that's how you kind of lay them out as you're studying skeletal remains. Bass also points out that hand dominance and any sort of bilateral asymmetry in the structure of the second metacarpal, these are things that are used by bioarchaeologists and forensic specialists to be able to at least identify handedness. And again, it's not an idealized kind of study. However, it is something that is supported with statistical analysis. So that second metacarpal is what we look at when we're trying to determine whether or not we can identify handedness. And again, we would compare that between the left and the right. And so the one that is demonstrating, in this case, more kind of a functionality, a greater expansion with regard to that metacarpal expression as it relates to, again, the strength of the bone, the cortical thickness, all of that kinds of those kinds of characteristics. These are things that definitely are incorporated into handedness. And then wear and tear. That's what I will look at. I'll look at the edges of both the proximal and distal surfaces of that second metacarpal, and then I'll compare that again left to right to, in a sense, consider wear and tear or use wear as it relates to hand movements and this particular bone of the hand. Again, nothing that is an exact scientific conclusion in a sense, but it gives you at least a forensic hunch to be able to connect an individual and remains with, in this case, somebody who is missing or somebody who could be the original owner of the skeletal remains that you are recovering from a site. So handedness, hand dominance is something that, and any sort of asymmetry, that's something to keep looking at. Because remember, you're using your hands prior to the age of 15, and that use will definitely impact. In this case, it'll create a bilateral asymmetry in the expression of the growth and development of that second metacarpal. The phalanges are the most difficult to identify and can be easily mixed up with, in this case, phalanges of the foot. However, there are some characteristics, and especially characteristics relating to the proximal articular surfaces of the bones themselves, their shape. This will be very, very helpful in determining the rows. One thing I did not mention, however, also for the metacarpals is when you're comparing them to the metatarsals, the articular surfaces, those rounded heads, those are also, their shape will also be a nice resource for being able to distinguish between hand and foot. But for the phalanges, again, it's that proximal articular surface that will help separate the phalanges of the hand from the foot, but then also it will separate the various rows of these phalanges as well. So the phalanges are bones of the fingers. There's 14 of them in each hand. When you are speaking about a single bone, a single bone within this field of phalanges, you refer to it as a phalanx. So a phalanx is a single phalange. Another way of kind of looking at that. So each phalanx consists of 3 parts, like we saw with our other short bone, in this case, our metacarpals. It has a base, a shaft, and a distal head. There are 2 phalanges in the first digit. These are called the pollex, or they make up the thumb. And then 3 phalanges in each of the remaining 4 digits. These digits, moving again medially from the thumb, are commonly referred to as, again, the index finger, the middle finger, the ring finger, and the little finger. Again, this is a cultural reference to these particular kinds of digits. The first row of the phalanges, the proximal row, articulates with the metacarpal bones. The second row of the phalanges will then articulate at the more distal end of that. The second row of the phalanges is referred to as the middle row. These articulate with, again, the proximal row and the third row, or the distal row of the fingers. The third row then of the phalanges is the distal row, and that of course articulates with the middle row, and the thumb is the only digit that has no middle phalanx. So a lot to kind of consider there when it's described to you, but what I'd like you to do is get into your BASS book and take a look at the phalanges, look at some of the illustrations, maybe even pull up some images online, and really try to get a sense of what they look like and how they're oriented, because they are very, very unique, but very easily confused with the phalanges of the foot for many different reasons, including their overall shape. But as I said, the morphological differences between these phalanges of the hand and foot relate a lot to the articular surfaces. So knowing where those articular surfaces are and the overall shapes of those articular surfaces is very, very important. The other characteristic, and this is something that relates very much to bipedality associated with the plantar surface of the foot, and then the kinds of biomechanical demands that we as human beings are putting on our hands. This is also something that can help distinguish between the phalanges of the fingers and the toes. The phalanges of the fingers are generally flat on the vomer or palm side or surface, and they're rounded on the dorsal surface or dorsal side. So that's another one of these kinds of unique characteristics. So flat on that palmar side, rounded on the, in this case, on the dorsal side. Again, think correct anatomical position when you're thinking about those different locations. All right, let me build a few ideas into your notes as we are approaching now some of the gross movements associated with the hand and some of the major muscles that I just want to highlight as part of this understanding of the biomechanics of this part of the skeletal anatomy. We recognize in this case 5 different kinds of movements that we associate with the digits, and so I'm going to kind of list these out for you, and you can pause the lecture along the way to be able to kind of distinguish them and think through the movement, because I think that's very, very helpful as well. So when you think about flexion, that's one of the 5 in this case. If you were to flex one of the phalanges, or one of the digits of the hand, I should say one of the fingers, not phalanges, one of the fingers or digits of the hand, it would be bringing the thumb, for example, close to the palm of the hand. That would be flexion. So as you bring the thumb across and kind of touch it against the volar or palm surface of, let's say, the distal end of that fifth metacarpal. That would be flexing or a flexion. If you were to extend, we'll use that first digit or the thumb as part of this understanding as well. If you're to extend it, right, you move the thumb away from the palm. If you're in correct anatomical position, you're extending it and maybe stretching it out more laterally or away from the midline of the body. That would be an extension. Adduction would be to move the digit, in this case, outward. So take that thumb, move it down, and point it away from your body. So if you were to place your hands on either side of your body with the palms facing away from you or whoever you are facing, a wall or a mirror or whatever the case might be, and you move your thumb out straight pointing ahead of you and then kind of extend it, that would be an adduction. Whereas abduction would be to bring the thumb kind of back into alignment with the hand and then squeeze it up against the, if you're in correct anatomical position, palms pointing forward, squeeze it up against the metacarpal of the second digit. So you kind of bring it in alignment with the hand and then push it up against what you can feel of the head of that second digit of the hand. That would be an abduction. Opposition, then, the best way probably to consider opposition, even though that's a movement that we're not going to highlight too much in this lecture, but opposition would be to bring the thumb and the little finger together. So the phalanges of the thumb and the fifth digit, if you're to bring those across palm side, across or together, and touch those two fingers together, that is opposition. That's an oppositional movement within the hand itself. Why do I mention all of this? Well, again, these 5 movement types, flexion, extension, adduction, abduction, and opposition, these are all unique and very challenging movements that require a pretty significant amount of dexterity. They are finite movements, and it's important then for us as anthropologists to recognize that the intrinsic muscles of the hand, these are extremely important for understanding kind of the unique human nature of the upper extremities and of the hands themselves. Now, the other thing I would like to do is I just quickly mention, I'll say, groupings of muscles associated with this image and the hand itself. Think of them as contributing to these major movement types. We'll recognize 3 principal groups when it comes to the muscles of the hands. There's the thenar, the hypothenar, and the intermediate. So the thenar, the hypothenar, and the intermediate. There are 4 thenar muscles, and these act on the thumb. You don't have to go any further than just connecting the location of those muscles and what they are, in a sense, connected to in terms of action. 4 thenar muscles, and they will act on the movement of the thumb. So a lot of the movements that I was describing with regard to the intrinsic movements of the hand, these are things that the thenar muscles are very much a part of. The 4 hypothenar muscles act on the little finger, and they include things like the hypothenar eminence. Just like in the thenar group, you have the thenar eminence in terms of the muscles themselves. And then you have 11 intermediate muscles, and these act on all of the digits except the thumb. So 3 major muscle groups and major movements of digits. 4 thenar muscles acting on the thumb, and you can definitely find that on the diagram, and I'll have another slide here that blows it up even more for you. You have The hypothenar, there's 4 of those muscles, and they're acting on the little finger. So the opposition that I talked about before, where you bring the first and the fifth digit together, that's incorporating all 8 of these muscles in that process, but chiefly the thenar and hypothenar groups. And then you have these 11 intermediate muscles acting on all the digits rather, uh, 2 through 5, but ignoring the thumb. So again, 3 major muscle groups, and then within these 3 major muscle groups, gross movements of certain parts of the hand. That's generally what I would like you to get from this description. All right, so as I promised, I will, or provide you in this case, with a kind of a blown up version of the palm and dorsal side of the hand. Take a look at where those major muscles, or at least groups of muscles, are. And just focus on that. Don't feel like you have to necessarily memorize or take note of all of the different tendon attachments and additional muscle attachments and things like that. Just focus on the 3 major groupings for this lecture, and for how we will look at the biomechanics of the hand and these 5 intrinsic muscles and muscle movements.